Affiliated with Dignity Health. Doctor, welcome back. First
Thank you.
text for this break, what's the difference between COVID-19 and is it novel coronavirus or novel? How do you say it?
Novel coronavirus.
Okay. So what's the difference?
COVID-19 is a novel, and the word novel refers to new, a new strain of coronavirus. There are many different coronaviridities that are out there. Some of us may have heard of SARS or MERS, and these were viruses, coronaviruses that caused some problems in the last decade or so. So COVID-19 is a novel coronavirus, a very specific one.
Okay, next one coming in. Our mail carrier not wearing gloves or a mask drops the mail in through the door slot like anything else. How worried should we be about germs, virus being on the delivered mail?
It is something to think about. The good news is the virus can live on certain surfaces like plastic or glass. It doesn't last as long on paper, cardboard, those kinds of things. I would say that gloves are not particularly useful because gloves can carry the virus on them the same way that your hands can, but we can't really wash gloves or use hand sanitizer on gloves. So I don't recommend gloves. Frequent washing, frequent use of hand sanitizer, would be a good idea for the mail carrier to wear a mask just so he or she doesn't spread the virus onto your mail.
Okay, the next question kind of plays off of that. If you make your own face mask, does it have to have any type of surgical cloth in between the layers that you've constructed here?
It's an excellent question. There's certainly lots of instructions online. The CDC even has some instructions regarding how to make a homemade mask. Unfortunately, none of those are going to provide the same protection that a certified surgical mask will provide. So in most cases, because we have limited supplies of surgical masks, we do recommend people use a community manufactured face mask. Using a couple layers, having it be pleated is helpful. The main benefit of the community-made mask is that if you happen to be sick and you're in that 12 to 24-hour period prior to symptoms developing where you can spread virus, if you wear that mask, then that helps prevent you from spreading virus to those in the community.
Okay. The next thing, if you have the face masks and you're reusing the face masks, what cleans them? Soap and water? Hot water? What do you recommend?
You can put them through the wash. So any kind of a detergent, soap and water, anything like that would work. And we do recommend that you clean those regularly, daily if possible. Certainly the amount of exposure that you're getting just out in the community with a mask is going to be very low. So the likelihood that there's some virus that happens to be on the outside of your mask is low. Nevertheless, it makes sense to wash it daily.
All right, we're talking to Dr. John Gisla. John, next one coming in, you're around someone who has COVID-19 and they somehow cough or sneeze near or on your food. You eat that food. Is that transmissible?
It is potentially transmissible. Yeah, so it's certainly something to think about. I think guarding food supply in that regard is something important.
Okay, next question quickly. Different blood types more susceptible to contracting coronavirus?
I have not heard anything along those lines. I think it's an interesting question, but no, I have not heard that a different blood type it may be more or less amenable to getting the infection.
All right, Dr. John Gisla, thank you so much. Thank you to all who